in the sexuality that testosterone is the hormone not only for the sex drive but also for aggression. We talked about that the most violent age group for men is 16 to 25, and this is when their testosterone levels are at their peak. The 16 to 25-year-olds are more likely to kill you. They're more likely to rape you. They're more likely to get incarcerated for violence. It's just, this is the age group. However, as women get older, their testosterones are unmasked. Testosterone levels are unmasked, and so women become more violent the older they get. On average, males engage in more aggressive and violent behaviors than do females. Yes, I can remember a statistic that I used to show. It's from a while ago, but it was like 3,026 murders, and that were made by men during that year, as opposed to 316 murders by females. Research shows that men with the highest rates of violence behavior also have slightly higher testosterone levels. So this is something that we've learned in the past. So I feel like on this chapter that there's a lot of review. So let's just review what you should be getting off this slide. Something that you had from the past is that testosterone influences aggressive behavior. Men tend to have more testosterone, so they tend to be more violent. I thought this was an interesting graph from your book, so I thought that I would put it on here. As you can see, here's the higher testosterone look for rape, for murder. Burglary isn't as high, drug offenses is not as high, and then armed robbery. Testosterone is also very impulsive. I'm not sure if the book talks about that, but testosterone makes us very impulsive, quick to do things. And that's why you might see this murder. Murder tends to be a lot about impulse, whereas armed robbery is usually premeditated. Burglary is premeditated. Some drugs can actually lower your testosterone, but murder, in my opinion, a lot of times is just a very impulsive move. Rape as well. Rape, a lot of times, I think a lot of you know that they say that rape is an act of aggression. And so you've got both the testosterone, higher rates of testosterone, sex, and aggression. Interestingly, testosterone alters the way people respond to stimuli. So they have a picture in your textbook that you might want to take a look at, is that we interpret faces differently as our testosterone levels rise and fall. It increases the response of the amygdala to angry expressions. So when we have high levels of testosterone, we interpret things as more attacking. It decreases the ability of the cerebral cortex to identify and regulate emotion. That's what I was talking about. That's the terms. I'm taking this from the book. That's what I was talking about. Testosterone makes us very impulsive. We don't think. We just act. So maybe some of you are looking at this slide saying, okay, Amy, what do you want us to get off the slide? I think the main points off this slide are that the testosterone it seems to alter the way we interpret stimuli, and it makes us more impulsive. So there you go. There's nice and clean. Testosterone alters the way we look at stimuli, and it makes us more impulsive. Okay, so now we're kind of past the testosterone. So we're looking at the brain parts, corticomedial portion of the amygdala, and then we looked at testosterone, and now we're looking at one more, we're looking at serotonin. And so what they found is aggressive behavior is also associated with low serotonin, which, if you remember with regard to sexuality, we said that like when someone has low serotonin levels, they become very random in who they want to sleep with. They become like somebody that will just sleep around with anybody. They say to themselves, they say, you know what, I don't care, I just want to get laid. Very random, which is that impulsive again. So when you have high levels of testosterone, low levels of serotonin, we become very impulsive and random in our behaviors. So turnover, they talk about serotonin turnover, is the amount of neurotransmitter that's released and resynthesized by neurons. And you're going to see that like what they do is they measure people's serotonin levels, and so that's why they're talking about that here. 5-HIAA is a serotonin metabolite found in the blood and cerebral spinal fluid and urine that allows researchers to infer the serotonin turnover rate. High levels of 5-HIAA imply much serotonin release and turnover. I remember one study that I saw said that they could tell with 80% accuracy whether or not a person was likely to go out and commit another crime or attempt another suicide by looking at the levels of 5-HIAA with 80% accuracy. So what they do is they measure this metabolite to see your levels of serotonin. Okay, in human studies, low serotonin turnover has been linked with people with a history of violent behavior, people who attempt suicide. Recurrent violent behaviors, a simple blood test does not enable reliable identification. So I guess we have to just dismiss what I just said, but I mean, I have seen some studies that say that if they test the serotonin turnover, that they can tell with 80% accuracy whether or not the person's able to go out and commit these crimes or commit suicide. However, they're saying a simple blood test does not enable this, so there would have to be much more, maybe cerebral spinal fluid analysis, urinary analysis. You can't just do it with a simple blood test. Serotonin activity is also influenced by genetics. We know that. Like if depression runs in the family, that's a very genetic. We're going to find out that in chapter 15, that if people in your family have a history of depression, then you are likely to be set up for depression. That's one of the most genetic mental disorders that there are. The genes control the production of tryptophan hydrolase, and this converts tryptophan to serotonin. People with less active form of this enzyme are more likely than others to report frequent anger and aggression. So here, I'm not going to ask you to remember about the tryptophan. I think the main point off of this slide that I'd like you to know is that serotonin is influenced by the genes, and we're going to revamp that point when we go to chapter 15, which is our next chapter, and talking about that depression tends to run in the family. The role of serotonin is very complicated and should not be thought of as the anti-aggression transmitter. During aggression, the brain releases serotonin. Clinical depression is linked to low serotonin. High levels of serotonin may inhibit a variety of impulses. So here on this one, the main points to get off of this slide is that basically we still have lots of questions about serotonin. The role that serotonin plays in aggression seems to be very complicated. So there you go. There's your nice tight sentence. The role of serotonin tends to be very complicated. Okay, now we're going on to anxiety. So again, with aggression, if you remember, it was the corticomedial nucleus of the amygdala. The amygdala is also an area that's involved in anxiety. But fear and anxiety are not necessarily associated with the desire to flee. So we're going to learn that the amygdala is also involved in anxiety. And see, anxiety can actually cause aggression. So that the two are located in the amygdala with different nuclei, they seem to influence one another. So this is what I started to talk about, that post-traumatic stress syndrome, is I was telling you about the startle reflex of, ah! So if that made you jump, then I would say you're under a lot of stress. If you're just like, what the heck is she doing? Whatever. Then I would say you're probably in a more relaxed state. So what I do in my classes is when I get to this point in the chapter, then I take a book and I throw it on the floor and I make them, jump. And since we're at the end of the semester, you'll see a huge startle reflex because a lot of people are under a lot of stress right now. But some people won't even jump, and I talk about that this is how they can measure how anxious you are. It's kind of interesting. By playing a loud noise or making a loud sound, how much the person jumps is actually a pretty reliable measure of how much anxiety they're feeling. Um, so um, this is just a recap of kind of what I was saying is like a lot of you are probably at home listening to this in a relaxed environment. And when I yelled like that, maybe you're just didn't startle at all. But what if you were in a classroom and a lot of people around you were talking and there was a lot going on and you were feeling overstimulated and then I did that really loud noise again? Do you see how that would influence your startle reflex?